Okay, thank you. As Margot said, I'll be presenting an overview of the Pathways of Care Longitudinal study and some preliminary analysis of data from waves 1 to 3. So the study has ethics approval from the various committees that are shown here. So this is just an outline of the session. So we'll start by just providing an overview of the study design and data sources. Then we'll have a bit of a look at some preliminary results from the administrative data that we have about these children. So their child protection histories before entering care, their placements while in care, and looking at how many have exited and re-entered. We'll then go on and have a look at the wellbeing trajectories of the children in care, looking at their physical health, their socio-emotional wellbeing and their cognitive learning ability. So this slide just gives you a bit of a picture of out-of-home care as at the 30th of June 2016 in New South Wales. So we can see that there are nearly 19,000 children in the care system in New South Wales, and there's an overrepresentation of Aboriginal children. About half are with relative and kinship care, around 40% are with foster care, and a small proportion are with residential care. Over half of the children in statutory care, as at 30th of June 2016, are with NGOs. As Margot said, the Pathways of Care study is an important piece of work, and it's a key input into a number of reforms that are currently underway in New South Wales, including permanency pathways, Their Futures Matters, and work that the Office of the Children's Guardian do around setting standards and accreditation of out-of-home care agencies. The main aims of this study are to describe children's pathways. So we're interested in how they come into care, what their child protection history is, what types of early intervention they've had. We're looking at how their pathways through care, the types of services they receive, the number of placements, the type of contact they have with their families, friends and school. And then looking at how they exit care. Are they restored to family, or do they stay in the system and age out at 18? We need to understand the factors influencing their outcomes in terms of their physical health, wellbeing and cognitive learning ability. We need this so that we can look at informing practice and policy, which in turn will improve the service system and ultimately benefit children in out-of-home care and improve their outcomes. So this study is being undertaken by the New South Wales Department of Family and Community Services in partnership with all the people listed here, and you'll be hearing from Judy, Paul and Alan after myself. We also work with Dr. Fred Bulshan from the University of Chicago, AFES, the Sachs Institute and iView, who collect the data for us. This diagram here gives an overview of all the data that's collected as part of the study and how it's linked together to form the final POCLS database that can be used for research and analysis. So on the top right we have FACS administrative data, and then the bottom we've got the interview data, and then over this side we have all our linked data from New South Wales agencies and some Commonwealth agencies that is linked together using Cheryl and forms the POCLS database. So within our study, our population cohort is 4,126 children who entered care for the first time ever between May 2010 and October 2011. Of these, 2,828 were on final orders by April 2013, and they're our final orders cohort. These children and their carers were invited to participate in the study, and of these, 1,789 agreed to have their details provided to iView. This forms our interview cohort, and at each wave of the survey, the interview cohort are invited to participate. So some people will participate in all waves, some people may participate in 1 or 2 waves, but they can come in and out at each wave. So this slide gives an idea of the participation in the various waves and the study overall. So at wave 1 we had 1,285 children and their carers. At wave 2 we had a similar number at 1,200, and wave 3 about 1,000. In total, around 1,500 children have participated in at least one of the 3 waves, and 882 children have participated in all 3 waves. This diagram shows the collection timeframes for the study, and you can see from this that waves 1 to 3 have already been completed, and the caseworker survey has also been completed. Wave 4 is currently in the field, and along with the teachers' survey, which has been ongoing since about 2013. The study includes direct assessments with children aged 3 to 17 years using the Peabody Picture Vocabulary Test, the Matrix Reasoning Test, and the Felt Security. We also undertake interviews with children aged 7 to 17 years, asking them things about their school, their friends, their health behaviour, how they're feeling, what sort of support they get, and what their caseworker's like. We do an in-depth carer interview, which involves collecting information about both the child and the carer. So you can see there the range of topics that are included in that in-depth interview, which usually takes about 108 minutes for the first child in a household and then 62 minutes for subsequent interviews. So that gives you an idea about the depth of information that's being collected. This slide shows the measures of child development which are used across the outcome domains by the age of the child and looks at the consistent measures that can be used across ages. So, for example, with social competence, the Ages and Stages questionnaire is used for 9 months to 5-year-old children, and then for 6 to 17-year-olds, the child behaviour checklist. There are also 2 online surveys which are part of the study. The first is with caseworkers, and that's been completed, and we had 1,625 completed surveys, and the teacher survey, which is ongoing, and so far we have about 670 of those. So we're just going to continue that survey to keep increasing numbers there. As I mentioned earlier, we have the FACS administrative data, which is based on the caseworkers' recording of their interactions with families and children in our kids system. So that includes child characteristics, child protection data, and their out-of-home care data. And we also have the linked part of the survey, so linking with a range of New South Wales agencies and Commonwealth agencies. So to date, we have the AEDC, we have education, we have justice data, and a range of health information there. Okay, so in the next part, we're going to just present some results from the administrative data. This is looking at the final orders cohort, so that was our 2,800 children. And we need to keep in mind that these are first-time entries, so they have a younger age profile, and children that entered care at a later age are more likely to have had longer exposure to risk of harm. So we can see from this slide that around 40% of children had less than 5 ROSH reports before they entered, and 2/3 had less than 10. This slide is based on the reported issues that come in the ROSH reports prior to entry, and in this slide we're focused on the parental issues of domestic violence, drug and alcohol, and mental health. And we can see here that 65% of children in the study had drug and alcohol as a reported issue, and 57% had domestic violence. And we can see that some children come in, around 28% have only had one of these issues, but 40% have had 2, and 12% have had all 3 issues reported. And we can also see that drug and alcohol and DV, 1/3 of children had those 2 issues reported. This one, we're having a look at the placement stability since they've come into care, and around 50% have 2 or less distinct placements while they've been in care, and 3/4 of children have 3 or less distinct placements. So when we're talking about distinct placements, it excludes respite care, emergency care of less than 7 days. This slide shows that the number of placements increases with the age of the child, the age at when they first entered care. So for those children that entered from 0 to 35 months, 60% have 2 or less placements, compared with around 43% of children who entered age 12 to 17. And at the other end, we see that those entering at 12 to 17, 16% of those had 6 or more placements, compared to 4% for the 0 to 35 months. At the 30th of June 2016, around 50% of the cohort was still in care and 50% had left, but most of those had left prior to the age of 18. And most of those had been restored back to their birth families. This slide looks at how long children were in care. So we can see that of the children who exited out of home care, 8% were there for less than a month and 29% were there for less than a year. However, we also know that 21% of the children that exited care before they were 18 years had re-entered before the 30th of June 2016. And most of those, 71%, re-entered within 12 months. This slide just shows that of the children that were restored, 23% of those had re-entered care. So what that data really, it's just really a bit of a snapshot, and there's lots of areas there that we need to look at in more detail and do some more analysis around to understand what the factors are that are impacting on that. Okay. So in this section, we're just looking at some preliminary results using the physical health as reported by the carer, the child behaviour checklist, the PVT, and the matrix reasoning test. So the results here are just descriptive and they're based on unweighted data at this stage. Weighting is being done for the waves. It's being developed at the moment. So looking at the interview cohort across waves 1 to 3, about 1,500 children have been in at least one wave, and we can see there that 54% entered care age 0 to 2, so that shows the younger age profile. Almost 40% were Aboriginal, and we had an even distribution of males and females. The child physical health is based on the carer report, so this is a subjective measure of how the child's health is faring. Carers were asked to give a general rating of the study child's current physical health using a 6-point rating from excellent to very poor, and the majority, almost 100%, indicated that children were in good to excellent health, and that's remained consistent over the waves. We also do collect information on health conditions that have lasted or likely to last for 6 months or longer and have been diagnosed by a health professional. And what we found there was that the majority of children, 55%, don't have a diagnosed health condition, which is slightly less than in the general population, where 63% don't have a diagnosed health condition. So the child behaviour checklist was used for children aged 3 to 17 years at wave 1 and for all children at wave 2 to measure socio-emotional wellbeing. We've reported the total problem scores with the mean of 50 and standard deviation of 10, with higher scores reflecting greater behaviour problems. So these are just showing the means at each of the waves, and at the total level, it looks similar across the waves, but when we have a look at, break that down by what they were at the baseline, so whether they were in the clinical, borderline or normal range at baseline, we do see that there look to be some changes over time, and it looks like the most vulnerable children have shown improvement. Just noting that this is based on children who completed all 3 waves of the survey. What we've done here is we've just had a bit of a further look at each of the categories, so wave 1. So we can see here that at wave 1, 27% were in the clinical range, and at wave 3, we can see that 30% of these children are now in the normal range, and 18% are now borderline. So we've done a similar thing with looking at the verbal ability, so using the Peabody Picture Vocabulary Test for children 3 to 17 years. So again, we've used the tracked sample across the 3 waves, so that's about 370 children. And again, the total looks similar across the waves, and the below normal, those that were below normal at baseline appear to have improved. The above normal do look to have decreased, but it is a very small group of children that were in that group at baseline. So here we can see that of those that were in the below normal range at baseline, 40% of those are now within the normal range. So with non-verbal ability, the matrix reasoning test was used for children aged 6 to 16 years to measure their reasoning ability, non-verbal reasoning ability, and again, higher scores reflect greater non-verbal reasoning ability. And it's similar pictures shown here, really. We can see that the below normal range appear to have improved. And with those that were below normal at baseline, 51% are now within the normal range. So to summarise our findings so far, we can see that approximately 2/3 of children in the final orders cohort had less than 10 ROSH reports before entering care. About 3/4 of the children had 3 or less placement changes, and the number of placement changes increased with age. Almost half of the final orders cohort had exited care by the 30th of June 2016 before they were 18 years old, and around 21% of those had re-entered, with 71% re-entering within 12 months. Of those that were restored, 23% had re-entered care. Preliminary analysis showed overall little apparent change on the verbal ability, non-verbal ability and behaviour problem standardised scores from wave 1 to 3, but when we had a closer look, it shows that children that were below the normal range at baseline seem to have made positive changes by wave 3, and children developing in the normal range at baseline generally maintain their developmental progress with some exceptions. The majority of children were in good health, and we will be undertaking further analysis to sort of tease out some of these things, look at the factors, do some more more in-depth testing to actually look at whether children have have made progress over time or not. So as I said before, we're currently collecting wave 4 data, and then in 2019-20 we'll be out in the field again collecting wave 5. We're also planning on doing some sub-study on new cohorts. One in particular that we've got in mind at the moment is those leaving care, so what happens to them after they leave out-of-home care. We'll be undertaking further longitudinal analyses on wave 1 to 3 and 4 and 5 when they become available that will support the out-of-home care reforms currently going on in New South Wales. We're establishing the POCLS databases and all the supporting documentation in the Shaw environment at the Sachs Institute. We'll continue to consult with stakeholders and setting up the POCLS advisory group, and we're in the process of developing a range of interactive dashboards which will be available online. Okay, and lastly, I'd just like to thank all of these people acknowledge all of these people and thank them for their involvement in the study, because without them we wouldn't be able to undertake the study and we wouldn't have such a rich set of data that will be invaluable for policy and programs. Thank you.